Hello, and welcome back to Riverside Chats. In the next few episodes, we'll dive into one of our huge programs here at Two Rivers. This program covers young and old, students and travelers, and just about everyone in between. We're going to be talking about vaccines. A vaccine is a biological preparation that stimulates the immune system to recognize and protect against specific diseases. Vaccines typically contain weakened or inactivated forms of the disease-causing microorganisms such as viruses or bacteria, parts of the microorganism, or toxins produced by the microorganism. When a person receives a vaccine, their immune system responds by producing antibodies and developing immune memory, which helps the body recognize and fight the disease if it is encountered in the future. What does that mean? Well, essentially, you get the smallest bit of the thing that makes you sick so your immune system can recognize illness. That way, when the illness is introduced to your system in doses that could actually make you sick, your body already knows how to fight it. Is this safe? Yes. For a vaccine to be allowed, it has to go through a rigorous, lengthy process to ensure that it is safe. The process of making vaccines involves several key steps, which can vary depending on the type of vaccine, viral, bacterial, or protein-based. Here's a general outline of how vaccines are typically developed and produced. First, identification and selection of antigen, a foreign substance in the body. Scientists identify a specific antigen, the part of the virus, bacteria, or toxin that stimulates an immune response, that will be used in the vaccine. This is often a weakened or killed form of the microorganism, a protein from the microorganism, or genetic material like mRNA that serves as an example of the virus. Then we go to preclinical research. In the preclinical stage, researchers conduct laboratory studies and testing to evaluate the safety and effectiveness of the vaccine candidate. From there, we go to clinical trials. If the vaccine candidate shows promise in preclinical studies, it progresses to clinical trials in humans. These trials typically consist of 3 phases. Phase 1, a small-scale trial to evaluate safety and dosage in a small group of healthy adults. Phase 2, expanded trial to further assess safety, check the ability to provoke an immune response, and dosage in a larger group. And Phase 3, large-scale trial involving thousands of volunteers to confirm safety, how well the vaccine works to prevent diseases, and to monitor for rare side effects. Next is the regulatory review. Regulatory agencies such as the FDA in the United States or the EMA in Europe review the clinical trial data to assess safety and efficacy before approving the vaccine for public use. After it's been approved, it goes to manufacturing. Once approved, the vaccine undergoes large-scale production. The manufacturing process can vary widely depending on the type of vaccine. Live attenuated vaccines produced by weakening the disease-causing virus or bacteria in a laboratory. Inactivated vaccines created by killing the virus or bacteria using chemicals, heat, or radiation, and subunit recombinant and mRNA vaccines. These vaccines use specific proteins or genetic material to trigger an immune response without using the whole virus or bacteria. Even after all of that, a vaccine is still being scrutinized while looking at quality control. Throughout the manufacturing process, rigorous quality control measures ensure that the vaccine meets safety, purity, and potency standards. Distribution and administration. Once manufactured and quality checked, vaccines are distributed to healthcare providers and administered to individuals according to vaccination schedules recommended by health authorities. And then there is monitoring and surveillance. After vaccines are deployed, ongoing monitoring and surveillance continue to assess their safety and effectiveness in real-world conditions. The development and production of vaccines is an extremely complex process that requires collaboration between scientists, manufacturers, regulatory agencies, and healthcare providers to ensure that vaccines are safe, effective, and widely accessible. Here's why we want you to know about vaccines. Preventative measures. Vaccines are used as a preventative measure to reduce the risk of contracting infectious diseases. By readying the immune system to recognize and respond, vaccines help to protect individuals from developing the disease or experiencing severe symptoms if they are exposed. We want you to know about vaccine schedules. Vaccines are often administered according to a recommended schedule, which may involve multiple doses given at specific intervals, particularly for children. Following the recommended schedule, helps to ensure the best protection against infectious diseases. I'm sure you've all heard this term before. We want to achieve herd immunity. Vaccines play a crucial role in achieving herd immunity, which occurs when a sufficient proportion of the population is immune to a disease, either through vaccination or prior infection. This helps in reducing the spread of the disease within a community and protecting vulnerable individuals who can't be vaccinated. I guess what I'm really saying is vaccines are an essential tool in public health because they can help control and eradicate infectious diseases. They protect individuals and communities from outbreaks and contribute to overall health and well-being of our community. As always, we hope you learned something new today. Stay happy and healthy. Until next time.